Hey gang, it's me, Dr. Jeff, an advanced trained non-surgical spine specialist and chiropractor of 20 years. Today, we're going to talk about bulging discs. I'm going to expose the truth. Before I do, I want to let you know that I'm also the author of this book, Never Look Back, a simple guide to the cause and care of back pain. In this book, which I wrote as a simple guide to help all back pain sufferers, we talk about which type of doctors you should be going to and what their tests should be running in order to find out exactly what type of injury you have, and they should be doing this quickly. If not, you should be firing your doctor and finding another one. We talk about the 5 ways people unknowingly daily hurt their backs and 5 ways to prevent it. We also talk about what makes a healthy back and neck, why that back would feel great, and then what makes an unhealthy neck. So our book is due to launch online within a few short weeks here at my website called neverlookbackpain.com. As we speak, it's under construction. It'll be ready within about 2 weeks. Neverlookbackpain.com in about 2 weeks will be up and running, and this is where you can grab our book. Then it'll be on Amazon and Barnes & Noble shortly. But again, it's under construction, but the book is done. It'll be out very shortly online. You can also go to freebackpaintips.com to grab some more free tips, exercises, little hacks in order to get pain to go away naturally, non-surgically, and things of that nature. So let's get to it. Let's talk about bulging discs, the truth exposed. So first of all, what is a bulging disc? Well, we can see right here, we've got a white bone on top, a red disc, and a white bone. The disc, in essence, is a water balloon, right? So it's made of about 86% water. And here's the structure. About 30% of pressure should go on this part of the bone and the disc. About 70% of pressure should go on the joints in the back. So it should look like this, okay? So what is a bulging disc? Well, think of a water balloon. If we were to squeeze a water balloon, the disc would bulge. As it bulges, okay, it spreads out. Same thing happens with a bulging disc in the spine. Well, what causes it to bulge? Well, I've been doing this for 20 years, analyzing x-rays, MRIs, CTs, and what I found is when the structure of the spine from top to bottom is not in great alignment, we start to lose this 70%, 30%, and 70%, 30%, and we start shifting the spinal bones out of place. And when the structure shifts, you start adding more pressure to the disc or the water balloon. And when we add more pressure to the disc or water balloon, it starts to bulge out. Where does the pain come from? Pain comes from a couple different places with a bulging disc. The outer layer of the disc has nerve fibers that sense, so when you stretch them, they can cause pain. The second way it causes pain is when it lifts and moves, the vertebrae lift and move, you're now stretching ligaments and muscles, and that can cause pain. And the last way is when it shifts and moves, it can cause an inflammatory irritation, a chemical process called neuritis, and it can irritate the nerves. So again, a bulging disc is a water balloon. Where does it come from? Well, it comes from, in my experience, when the vertebrae move out of alignment, they start to compress the disc where it doesn't belong. So what's the truth? The truth is, does it need surgery? Well, in my office, we found that it doesn't. A bulging disc doesn't. Well, how do we fix it? Well, if your house was falling apart, what would you do? You'd repair the structure. So with the bulging disc, what needs to be done is the structure needs to be identified. Where is it out of alignment, and why are we putting more pressure on this compared to this? Where are we out of alignment? And if we gently restore proper structure, like rebuilding a house, then all of a sudden we can take the pressure off the disc. The disc will no longer stretch. The fibers will no longer, the nerve fibers will be irritated. The inflammatory process comes down, and you start to restore proper balance or homeostasis in that segment, and the pain starts to go away. So I'm exposing the truth on a bulging disc. Do you need surgery? Not necessarily. What caused it? In my experience, improper structure of the spine. How do we find that improper structure? Well, first and foremost, you got to see. So you have to have a set of x-rays to look at your spinal structure. You've got to know what normal looks like and abnormal. In my book, Never Look Back, A Simple Guide to the Cause of Care of Back Pain, I share with you what a proper spine looks like, and then where proper spinal misalignment happens and what that looks like and what it can cause. Once we see that on x-ray, then we can then do an MRI, because the x-ray will infer something's going on. Then an MRI will show us clearly what kind of disc injury is there, and then we know how to help you out. This is Dr. Jeff. I hope you enjoyed this video. If you did, leave some comments below. Subscribe to the channel. Like it. Every Thursday, I'm releasing a new video. Tips and tricks on how to help your back pain. I've been doing this for a long time. I enjoy it. I want to help you. Release the book. Again, Never Look Back, A Simple Guide to the Cause and Care of Back Pain will be released on neverlookbackpain.com in just a few short weeks. I encourage you, pick it up. It's like 23 bucks. It could save you thousands of dollars at the spine surgeon, at your doctor's office. It'll save you headaches. We tell you many simple things on what you can do to help yourself out with your back pain. This is Dr. Jeff, advanced trained non-surgical spine doc. I'm a chiropractor of 20 years. Looking forward to helping you. Have a great day. I appreciate all of you.